the UAE and others trying to fund movies like Matt Damon's movies to tell you how horrible it is. There has still, and a new one came out recently, never been a case found where hydraulic fracking has actually polluted groundwater. And so, as long as that's the case, let's be drilling safely, but we can do it.
Next one's also an energy question. It says, the EPA has approved ethanol content gasoline to be 15%. However, House Bill 875 and Senate Bill 344, which ask the EPA to delay this, are held up in committee. So will we see E15 with an eventual E30 if the EPA has its way? Does anyone in charge realize what the high ethanol content does to carbureted engines?
And a lot of us realize what that 15% ethanol does to engines, what 10% does. 15 is going to ruin a lot of engines, and a lot of us realize that. I really, really hope that we can remove the ethanol requirement on gasoline. And I think that's the way most East Texans feel. You know, when we were in a big energy crunch and we never thought we could be energy independent, that was one thing. They're using some of our very best corn is not going for eating now because it has a higher sugar content. And I've got dear friends in Iowa, and they've had me up there to speak at a couple of events, and they were really great folks, and I know they love the ethanol requirement, but it's just not right. If the free market can drive ethanol and cause that to be a good answer, fine, but it's not. It's mandated, and I'm really hoping that we can undo the requirement and just, you know, let the market drive it. If people want to buy gas with 10% ethanol, fine, but they're not going to be doing it, and I think, well, that's where I hope we go. And I know there are a lot, I've talked to a bunch of senators in the Senate, they realize that. But let me just tell you what we're up against, and that is this. The presidential campaigns start in Iowa. And I've just come to love the Iowa people. But everybody thinks they got to pander that's running for president about ethanol requirements. And so I'm not encouraged. I mean, people in both parties at the top say, hey, you're going to hurt us in Iowa if you work any harder to repeal the 10% and now the 15% coming. So I'm still hoping we can. It's the right thing to do.
Thank you. It says, where do you stand on Congress getting those Obamacare exemptions?
Well, believe it or not, that hurt. I felt like when we recessed the 2nd of August, that we were building momentum for members of the House to stand firm and say, we have funded every other aspect of the government, so the government will not be shut down. Now, just defund Obamacare. You've already given a pass to big business. You know, you've given waivers to cities of different kinds. You've given different types of waivers to different people. The exchanges are not ready. This is not ready for prime time. So why should you force this when it's going to be very destructive to people's health care? And most, 60% or so, don't want it. So I think we ought to take a stand. And our leadership is scared to death. They think that if we have a shutdown or a big showdown, we may lose the majority, and for sure they'll lose their leadership positions. Well, you know what? Say what you will about the Democrats and Speaker Pelosi, but I'm told they realized when they passed Obamacare that there was a risk they would lose the majority because of it. They realized that. Yet they were so intent on passing that bill because they knew in the end, if they pass Obamacare, then they're going to ultimately control everything. The government will control everything. and they were willing to take the risk. What does it say about Republicans if we are not willing to stand up for what we know is the best thing for the country? So, politically, let me tell you, now, right now, Congress gets the same supplement every federal worker does in the whole federal system across the country. And that's 72% of the health insurance premium is paid for by the government, which means you. And that's the way it is right now. Now, with Obamacare, there was no provision for that 72% to continue. And so actually it was helping those of us the last couple of weeks who were trying to recruit people in September to stand firm and don't give in. Let's fund every part of the government except Obamacare, and we stand firm. And frankly, there were people going, I just found out how much I'm going to be out come January if this thing isn't stopped. So now I understand, from what I understand, Boehner had staff and Reed had staff there meeting with the president and the Office of Personnel Management, OPM, before the decision was made. But I can tell you, when they announced that they would go ahead and continue after January 1st, covering 72% of Congress's premium. Now understand, we're not exempted from Obamacare under that decision. We lose our insurance, and so there are still a number of staff members, other members of Congress have told me, yeah, I've got staff probably going to retire. They've been working with the federal government for more than 20 years. They know if they retire before January 1st, they get to keep the same insurance. If they wait till January or after, they are under Obamacare. And so we're going to be under the Obamacare exchange come January, but it's just, so all that exemption did, it means we're going to have 72%. And I hope that we can undo the whole thing. And I hope that people are getting an earful in August. So, and really, it's been exciting for me to hear messages or see little things in papers from around the country, people that we've been trying to recruit to stand with us that are now saying after some town halls, hey, we're not going to fund Obamacare. I'm going, wow, I was really trying to get that commitment before we left. And so, but that, it was very clever of the president to do. And since our leadership did not want to risk standing firm on defunding Obamacare, it probably didn't hurt their feelings either that was done. And by the way, those that were exempted, and it was really clever the way it was written, because at first, most of us that read it thought that everybody in Congress was covered, because it says everybody that's covered by the MRA, which is, you know, the members' budget, everybody that's covered by that fund, you know, is under Obamacare. Well, I didn't realize at the time I saw that our leadership in the House and Senate are not, they're paid out of a leadership fund and not out of that fund. So Speaker Pelosi, when that passed, knew she would not be covered under Obamacare. A little clever ploy.
This one's a follow-up to that previous question. It says, when you attempt to defund Obamacare, what is your plan after the president vetoes the bill?
Now, this is what really irritates me, because there are so many people that have said, you know, Republicans have no plan, they have no alternatives. I've had an alternative for like 4 years that I've been pushing, and I tried to get scored for a couple of years, and CBO wouldn't score it. And Newt Gingrich had said, Louie, if you can get this scored, it may just change the whole debate over health care. And you know, Mike Burgess has a great bill. I think mine's better. Mine's 28 pages. But basically, and this is what I will continue to push, to have legitimate reform in health care. There are a number of things that need to be done, and we do need reform. But for one thing, you can't have a free market healthcare system where people don't know what things cost. you have got to have honesty, and it's not because, you know, the healthcare providers don't want to tell us what it's cost. It's because, and I've asked people here in Tyler and other places, well, what does a single bed for one night cost? Single room, one bed. And it's always, well, it really depends, you know. And it does on a million different things. But basically, do they have Blue Cross? What other insurance do they have? What insurance they have? Do they have Medicare? Do they have Medicaid? Or they have no money at all? It all depends. It should not depend. And under the system now, and I know people regret that it's worked out this way, but if you can't afford insurance and you go to the hospital because of some tragedy, you got no insurance, and you're not on Medicare or Medicaid, then normally they have you sign a note, and they'll give you a reduction in the cost. But all that I've seen, it's never as cheap that you're going to pay out as what Blue Cross paid. You know, they give you a reduction from what they say the price is. You know, my daughter was in an accident, it wasn't here in East Texas, and got a bill for 2 MRIs for $12,000, and the insurance company was told paid her between $400 and $500 each. Well, it ought to say $400 or $500. It shouldn't say $6,000 a piece. So we have to have truth in healthcare costs so that you can pick and choose. And when I grew up in Mount Pleasant, we had a number of really excellent doctors there. And it's a small town, but we had different good doctors. And we went between 3 different clinics, frankly. And as a kid, I once asked, why aren't we going back to Dr. So-and-so? Well, he just upped his price. And this doctor's every bit as good as he is. Oh, okay. And that satisfied me. You can't do that now. You don't even know what things cost. That's important. And in trying to figure out an alternative to Medicare and Medicaid, and there have been some letters to editors and even some editors that wouldn't look at the proposal properly. But when we looked at how much we're paying to operate Medicare and Medicaid, and you divide it by the number of households in America, and all of these are estimates. We couldn't get the absolute correct number from anybody in government, including the Census Department. But approximate number of households with somebody on Medicare and Medicaid is between $20,000 and $30,000 per household. And most likely it was between